Welcome back to Life's a Mom. I'm so happy you're back with us. Today we have someone that is a dentist. Now, when we say dentist, sometimes we get a little fearful, but I promise you, she is not going to eat you. She's not going to bite. So,
No,
Agatha, thank you for being here today.
I am so excited and thank you so much for inviting me. I'm very excited. It's my first time ever doing a podcast.
Oh my
So
gosh.
I'm extremely excited to be here.
I'm
Thank
so
you.
happy. Yes. So, do you mind telling the listeners a little bit about yourself, how you became a dentist, just your background?
Sure. So yes, everyone, not everyone, but most of people don't like dentists. And I hear that. I know it. I'm not surprised by it. It's okay with me.
Yeah.
And I understand why too.
Yeah. I
It's
mean,
a long story. So I became a dentist first time in my country, Lithuania. That was long time ago. I moved here to US and I went back to school and became a dentist for a second time here.
wow.
And in this country, I've been a dentist for over 10 years now. I love it. It's a very great field. It's always exciting, always changing. Very good field to be. I love it.
I love that. So, why is dental health especially important for moms, particularly during pregnancy and postpartum?
Yes, pregnancy affects our the whole body and hormones go crazy, go up, and the whole body goes crazy. It's a new thing and it's a very hard thing for women to handle physically. Gums get very sensitive, inflamed, red. It definitely impacts our oral health and we can bleed. The good news is after pregnancy, everything calms down. So it's not really very harmful or scary. Just keep your mouth clean while you're pregnant. After the pregnancy, everything's going to be normal again.
Yeah, I remember when I was pregnant and I would floss, I would bleed even when I brushed my teeth.
Mm-hmm.
And I was like, what is this? I usually take very good care of my teeth. I
Yeah.
actually never had braces before. My dad was very on top of me as a kid, like with my teeth. And so I was like, why am I bleeding? So I went to my dentist and she explained to me, like, it's just part of pregnancy, the hormones, everything.
Hormones. Yeah, it happened to me too. I have three
Really?
kids, three pregnancies. So I went through that too. And similar things happen with teenage years too, because hormones go crazy and gums can bleed. It's normal part of life.
Yeah.
It
So
comes
not
down.
don't be scared
No.
if that happens to
No.
you.
And there are no long-term harmful effects.
Yeah. So what hormonal changes during pregnancy affect oral health? Is it just the gums or is it
Um,
more than that?
Gums, yes, the levels go higher, and the gums
Yes.
get like puffy and red, and they just bleed very easily.
Right.
Usually, it doesn't affect teeth that much,
Okay.
and after the pregnancy, they calm down. So it's really most of the time it's just gums, no teeth.
Okay. I don't know if this was just in my head, but when I was pregnant, I felt like my teeth were looser. Could that be a
It's
thing?
possible. It's possible because gums get perky and flatten. It's
Okay.
possible. It's
Okay. So
possible.
yeah, I was
But
like, what?
after that, probably it all calmed down.
Yes. Now we're all back to normal, thank God.
Yeah.
So how early should children start seeing a dentist and why?
As soon as they get a first tooth, which is probably like six months of age, it's just nice to establish that relationship, and we can go over about how to keep it clean with the mom. And there's no such a thing as too early.
Right.
Come
Yeah.
and yeah, you're not afraid of the dentist anymore.
Yeah, no, my son loves the dentist. Like the dentists love him because he just comes in, he goes, "Ah, I'm a dinosaur." He just loves
Yeah.
it. I'm like, "Oh my God, I hope it stays that way."
Oh yeah, absolutely.
Yeah,
Feel he
so
has that no fear. The
no
dentist is
fear.
normal thing. Yeah.
Yeah, and then you have kids who scream and you have to come to clean the bottom, so everyone's different, but it's nice to see that my son loves
I
the
think it
dentist.
goes from the parent. If
Really?
parents are afraid of the dentist and children feel it too. Yeah,
Yeah.
and the children feel it too. But you're doing a great job. You establishing that relationship with the
Yes.
dentist. Dentists are good. They're fun.
Yeah, he went to the dentist at a little bit early, like 10 months old. He
Yeah,
had 4 teeth and she told me I still have to floss and I didn't
yeah,
know it was
yeah.
so
Good
much.
habits. Good habits. It's
Exactly.
never too early.
Right. So now he loves brushing his
Yeah.
teeth. So it's great. Um, do you brush your teeth with your children every night and morning? How's your routine with your kids? It's
So
hard.
yes, yes, and that's the thing about kids. Even my 9-year-old. I still supervise her from time to time.
Okay.
She has electrical toothbrush, so she does it on her own.
Okay.
But still, from time to time, they're kids.
Yeah. No,
They're
of course. Do
kids.
you also see children or just adults?
I do, but it's usually because it's more convenient for a parent. I advise just go to those kiddie places.
Yeah.
They make it fun. They
The
have the
TV.
toys,
Yeah.
TVs, so it make it all fun experience. It's
I
kind of like a
agree.
game.
Yeah. Yeah. It's a little scary for a child to
Yeah,
come in and see like
yeah,
blank walls, so
yeah.
I agree with that. So why do so many people fear going to the dentist? Like, where does that anxiety start? Where does it start?
Well, there are many reasons. First, of course, that assumption that it's gonna hurt,
Yeah.
which could be true because sometimes, we delay the visit until big problems happen. So it's
Yeah.
possible that fear comes from something, you expecting that's gonna hurt, it's gonna be loud, and partially it's true. The good news is the more often you're gonna see the dentist, the less unpleasant experiences you're gonna have because you're not gonna,
Ah,
yeah. And so that's one part. Another part, parents, how they're afraid of the dentist, kids feel it. So it feels like, you have to be afraid of the dentist.
yeah, yeah. Yeah, it's a big stigmatism around
Mm,
dentistry, and, I mean, I have to say, I've been to different dentists. I do fear the dentist, but it also depends on the dentist, because some dentists are very warm, they make me feel comfortable,
yeah.
and then some dentists are like, "This is what we have to get done. Like, it's gonna hurt. It is what it is."
They're people. Maybe
Yeah.
they're like, have something at home going on. It's
Yeah,
not a good
no
thing.
no
It
judgment.
happens. It happens.
Yeah.
But you have to find a personality that you like.
Right. It's kind
Mm-hmm.
of like with therapy, like it
Mm-hmm.
has to be a puzzle piece,
Yeah,
not everyone is gonna be the match. So
exactly.
it is a
Exactly.
big part of it, I
Yeah.
agree if you think that,
You have to
right?
find a place that you like, that people work, and
Right. 100%. So what can moms do to help prevent dental anxiety in their children?
you make it fun. You make it
But
fun.
how? How would we make it fun?
So brushing at home, you can sing a song, brush, brush, brush your teeth. You can watch YouTube videos.
Oh,
You
that's a good
can
one.
buy fun toothbrush together. So you make it fun for the home routine. Then when you go to see a dentist, you also, like I said, that's why I like those pediatric dental offices
Yeah,
because they have balloons or
right.
video games. So you
Toys.
make it fun.
Yeah.
Yeah.
Yeah, the dentist office that my son goes to, they literally have an arcade.
Oh yeah. I mean,
So he's excited to
yeah.
go, yeah. And he loves the doctor, the doctor's so sweet, they're good with children, and not everyone is patient with children because children can be a lot of work, right?
Oh
So,
yeah. Every time you make it more fun, children will want to go.
yes, exactly. And what are the most common oral health mistakes that busy moms make?
Well, one mistake, letting kids do whatever they do, like, trusting them that they're going to do a good job brushing.
Okay,
They're kids, they get lazy. So from time to time, we still need to supervise them, even like a 10-year-old.
right. But what about moms, like us
Oh,
as
them.
moms?
Well, we get so busy, we just simply forget about ourselves. That's a common mistake we do about everything, our mental health, our physical health, our nutrition. We cook for our kids, for ourselves, just leftovers.
Yeah.
So we just forget ourselves. Same with oral health. We just forget to brush or happened to me many times too at the
Yeah, you
dentist.
see?
And I'm like, oh my gosh, this morning I forgot to brush. I was feeding kids, I was rushing to get to the
It's a
daycare,
lot.
and we forget ourselves. That's the biggest thing, I think.
Yeah. But if you had to pick one thing, like for busy moms that are super, super busy and they don't have time to do anything, they can't floss and brush and do mouthwash and the tongue scraper. If there's one thing that they have to pick from to do that's the most important, what would that be?
So there are little shortcuts, and I have some dental secrets, like I told you.
Oh, love it.
So one secret is that the morning brushing is not that important. I
Really?
mean, you brush it a little bit, freshen up, that's okay. Just to freshen up. At nighttime, that's when you have to floss and brush. Mouth rinse, it's optional. You can skip that step. It's not that important. But
But doesn't that
morning,
help prevent gingivitis?
well, if your teeth are clean, mouth rinse actually can dry out your gums too. So I'm not a super, it's good to have it in a purse after the coffee to rinse it out or after lunch, but it's not necessarily, that important at night or,
Okay.
it's kind of like a bonus step. If you're going to skip it, it's okay.
So she came to one of my events, and she's so amazing. She brings, like, little Listerine bottles. So, do you recommend, like, moms to take that with them and try?
Oh, just like, yeah, if you forget to brush, like it happens to me, in the morning. So you want to freshen up because, you don't want to scare your friends with like, morning breath.
Yes.
So that's okay to skip that and, sometimes and do a mouth rinse. But at night, you need to brush and floss
Gotcha.
at
Okay.
night.
At night.
You can shorten the morning routine.
Yes.
You can make it really minimal.
Yes. So, nighttime is the most important, guys. Maybe when you put the kids to sleep.
Make it your me time. You can make it
See?
your me time.
Not a
Yes,
chore.
and yeah, you make it your me time. So then, whatever, sometimes you can just floss your teeth and brush with a fancy toothbrush. Make it something like a reward for yourself
I
after the
like
long day.
that. Yeah. Because I don't know about you, but when I get to do my self-care and I get to go to bed after I did my skincare, brushing my teeth and my lotions, I just feel good. I feel good
I
going to
mean, you
bed.
have to do it anyways.
Yeah.
So might as well put your kids to bed and do the flossing.
Yeah.
Well, another little secret about the dentist, we don't really love flossing that much either.
It's not
So
fun.
yeah, it's a lot of work.
It is.
Simplify it. I use water pick. So then I water pick and then I brush. So it's like my me time.
Can you explain a little bit about what the difference is between a water pick and floss? Does the water pick get more of plaque?
Well, they did a lot of studies and apparently it's very effective, which I kind of trust because that water stream removes debris in between the teeth. And that's all we care. Personally, I don't care if you use floss or water pick, as long as it's clean, that's all it matters.
Right.
So to me, it makes it easier. Just water stream, I go all over my teeth. It's much easier for me.
Interesting.
So I'm a big fan.
I like that. And then, like, when you have people come in to, to do their cleaning, do you see a difference in how much more does one person get more plaque than the other? Like, is it genetic?
Oh, yes.
Yeah.
Genetics play a little role,
A
but
little.
not that much. And another little secret of the dentist, when we ask you, do you floss? We already know. We already know.
Wait, so even if we floss the same day,
Oh, yeah, yeah, yeah.
you can tell?
The plaque that we see on your teeth is a buildup over more than one day. The plaque that is there from today, it might be just a food debris from my breakfast. That's different. But if you don't
Oh,
floss for like 6 months and you only floss last 3 days before coming to see us, we know. Even though we asked that question, do you floss? We already know it.
you're testing us.
Yeah.
You're testing us. I love that. Okay, so from now, because the day of the dentist, I make sure I floss extra
Oh,
good and
yeah.
oh
Which is
my,
okay. But
yeah.
that doesn't make that big of a difference because,
Wow.
if you have a little food debris from breakfast, it's okay. It's not a big deal. But if you haven't flossed for 6 months before coming, that's a different plaque. That's a harder, the stickier, and you cannot actually remove anymore. So that's why we do know.
Is
If
that why people do deep cleaning?
Usually, yes. Eventually, it gets to deep cleaning because when you have plaque for a longer time, your gums get the deeper pockets. So when we measure the pockets and they're deeper, that means you need a deeper cleaning.
Wow, and that's from not taking care of your teeth?
Usually, genetics add up too,
Okay.
but yeah, that's a years of development to that point.
Okay.
So it's not couple.
So if someone were to do a deep cleaning, does that mean they don't have to go every 6 months? Maybe they can wait longer?
No, actually, it's opposite. Once you have that deep pockets, you cannot go completely back. So now after the deep cleaning, you will have to get cleanings every 4 months usually.
Oh my
So you
gosh.
cannot like completely reverse it.
So is it like the rest of your life you have
Pretty
to No
much. Pretty
way.
much, yeah.
Oh my gosh. So what's the difference between the cleaning and the deep cleaning?
So a regular cleaning, we call it prophylaxis. That's when you have healthy gums and not the deep pockets, not those deep pockets. We have special measurements. The deep cleaning, when your gums were neglected for a longer time and you need deeper,
Deeper.
yeah, more
Okay.
profound cleaning. And after
Wow.
that, usually gums don't grow back completely. So now you kind of rest of the life, you need not deep cleanings, but more often follow-up cleanings.
Interesting. Okay, that's good to know because I never know this thing. My
Yeah.
doctor says, you need cleaning, you need deep cleaning. I'm like, okay, what do I know? I'm trusting my dentist.
So
Um,
prevention is always the key. If you
Yes.
can prevent and stay healthy, so not to get to that point.
Right. It's almost like the same concept as, if you want to be healthier and lose weight, you can't just go to the gym one day, right? If you go to the gym for 5 hours for one day, you're not going to every day. You have to
Exactly.
go 30
Better
minutes
30 minutes, even 20 minutes, but you do every
every
day.
day.
Every day,
Same thing
20
with teeth.
minutes versus 3 hours once a week. No, it's not the same.
Right. Same thing with the teeth.
Same with the teeth.
See? So is it true that pregnancy can affect your teeth long term?
Usually not. Usually
No?
all is reversible.
Okay.
Like you mentioned, your teeth felt a little bit loose, which it could happen, but probably after pregnancy, they went back to their
Yes.
normal state. Yeah.
Thank God. I was
Mhm.
so worried. I'm like, oh, my teeth.
Yeah.
And I had dreams that my teeth were going to fall out because I think I had so much
Oh, yeah,
anxiety
yeah.
and I was scared to go to the dentist. But luckily, everything was fine. So, no, most
Usually not.
usually not. Okay. So, what's the condition between oral health and overall health?
It's all connected. All body is connected. Of course, that is where done. If you have bacteria in your gums, it could go to your heart, which is true because it's all connected. But also mentally, when you take care of your teeth, you take care usually of your nutrition. It's just the whole cycle. When you neglect your nutrition, you don't care about your teeth anymore. It's all like snowball effect.
Yeah,
So
it
the
makes a
whole
lot of
body,
sense.
mental, physical is all connected.
Yeah, and I mean, listen, that's true, but it's also super hard. I feel like for moms. So like if they're having, days where they don't brush or they don't take care of themselves, like you can still get back on it, right?
Yes, 1 or 2 days is not gonna make a difference.
No.
Couple months, yes.
Yes, that would make a
Mhm.
big difference. I'm sure plaque and
Yeah,
so I'm sure when
yeah.
you see your patients come in, you're like you can see the difference of who has more plaque versus not, who's taking more care
We
of their
do see
teeth.
that. We do see that, and that's okay. That's okay. That's what we're here for.
Yeah.
And another little thing, I get very excited when I see a patient on a schedule. It says, haven't seen the dentist for a couple years.
Uh-uh.
I do get so excited as a dentist. It means, oh, yes, let's put this person back to the health and everything is going to
Yeah.
be so impactful. So I do get extremely excited to help someone.
Yeah.
It
But do you
feels,
find that those people are more afraid of
oh,
dentists?
yes. And
Yeah.
that's another thing that I really like because then I can hopefully convert them, get that fear
Yeah.
out. It's okay. It's been a couple years, you missed. Let's see what we can do now.
Yeah.
So to us as a dentist, we usually don't judge people. We really just
That's what
want
we
to get
fear. We fear being judged. Like that's why we brush our
Well,
teeth
that's what
before the
we're here for.
dentist.
That's what we're here for.
See? So don't
Yeah.
fear the dentist. Easier said than done.
Yeah.
So are there any specific nutrients that support dental health for moms?
Absolutely. And kids too.
Okay, let's hear
There
it.
is that one myth that we think candies cause cavities, which is true, but it's
Right.
not just candies. And as moms, we show the example to our children and we are busy. We need snacks in a car, in a
Mhm.
purse all the
All
time
the
because
time.
it's helping with the kids. They get
Yeah.
hungry, they get cranky, and oh, that's not good. So we like to buy snacks, and we usually buy crackers, anything like goldfish and all those things. Those can cause cavities too because they're carbohydrates and they stick to the teeth because they are so sticky.
Wow.
It's not just candy. Also, even looks like it's healthy. Of course, gummies are terrible because they,
Yeah.
stick
Yeah,
to
yeah,
teeth.
yeah.
But the same thing actually dried fruit because it's
Really?
also very sticky and sticks to the teeth. So instead of giving those candies, we can do simple substitutions like packaged nuts. Nuts have magnesium and calcium, and they actually help teeth. Cheese strings, I always have cheese strings in my purse for the kids, for myself. They are super healthy, those snacks. You have it in your purse. It has calcium, has no carbohydrates. It's a
Wow.
very easy to give to the children and
Yeah.
ourselves. I always have carrots, baby carrots.
Mm.
They are crunchy. They actually remove the plaque. It's kind of like a nature's toothbrush.
Carrots?
Carrots, sliced cucumbers for the road trips. So all those things instead of goldfish gonna go a long way.
Wow, I never thought that goldfish would cause cavities.
Yeah, it's carbohydrates and it's sticky and it sticks in between the teeth
Oh,
and
no.
it's not the best snack.
Yeah, and let's be honest, our kids don't always do the
Yeah.
best job when it comes to cleaning their
But
teeth, so
there's so many other yummy snacks. Even those like cheese crisps. I forgot how those are called.
Cheez-Its?
No, more
No.
like a dried Parmesan cheese.
Okay.
Cheez-Its, I think, is gonna be like a cracker too.
Yeah,
Mhm.
yeah.
Like dried Parmesan chips, if you know. kids like the crunchy things.
Yeah, so crunchy things are
Crunchy is
good.
good, if they're
Okay.
made from cheese only, not
Ah,
those cracker ones with
right,
flour.
right. Wow, so it's more than just the candy and the gummies.
Yes.
Chocolate.
Even though, like, I love oatmeal, but oatmeal is also sticky. It's healthy,
It's
nothing wrong with it. So just make sure that after eating oatmeal, you rinse your teeth if you're traveling at least with the water because it's also sticky. Also
interesting, but does the water get everything? No.
it helps a little bit. You
Yeah.
rinse it out, so
S
you remove some of that.
Yeah.
And if you're gonna snack with nuts after that or cheese drink after that,
That
it's
helps.
gonna it helps to clean
Like
it.
you said, natural toothbrush. I like that.
Nature's toothbrush,
Nature's toothbrush.
carrots.
Yeah,
Yeah, I'm crazy about carrots.
I
I
love
always
that.
have them in my bag.
So speaking of the flossing, for kids, is there something that they can use instead of the floss picker? Because my son hates it.
Oh yeah, oh yeah. Again, you can buy those water streamers.
For
Water,
kids? Is
even
that
for
too
kids,
hard for
they have it, and you can adjust. They have kids-friendly ones. You can adjust the strength.
Oh,
Yes, you can floss. So either tool you choose to keep it clean, it doesn't matter. As long as it's clean, that's
that's
all
all
that
that
matters.
matters.
Yeah,
Keep it clean.
yeah.
So I know we spoke about cleaning, but how often should, adults really be getting cleanings and why do people avoid them
So yes, if your gums are healthy, every 6 months is plenty.
every
But
6 months?
every six
I go
months,
once a year.
once a year,
That's not good.
I would like to see
See
every
more.
6 months more, just
Okay.
in case there's some pockets in the back you might not reach it. So it would be better every 6 months if you can. If you get to that deep cleaning, then usually you will need more often follow up every 4 months.
Gotcha. I think I might need one of those or more. But
Ah,
so yeah, it's all depends what my mouth. So now I'm just gonna tell the
um,
truth to the dentist.
yeah, every 6 months, and find also the hygienist that you like.
Yeah.
Again, it's personality match. You're gonna like some people like more gentle cleanings. Some people like more profound cleanings, believe it or not. Yeah,
Really?
I had patients who said, "Oh yes, I want really profound. Make sure you make it really
Wow.
extremely clean." And some people, "Oh, my gums are more sensitive. I want more gentle."
Yeah. Is it
So
true that, sorry to
yeah,
interrupt,
no,
I have bigger teeth. My
mhm.
husband has smaller teeth. And every time the dentist sees me, they're like, oh, I love that you have big teeth.
Yes,
Yeah, because
yes.
the smaller teeth are more sensitive.
No, it's not sensitivity. It's for us as a dentist and me too. Longer teeth, bigger teeth give you that youthful look. So as a woman, I want to look youthful.
Yeah.
So I did my cosmetic work on my front teeth, and on purpose I made them as long as my bite could allow it to, because that gives you that youthful look. Yeah, so
Interesting.
that's
See,
a little cosmetic secret. Yeah.
okay, that's good to know. So with me, I know dentists don't work with jaws, right? But my jaw is very narrow and I never had braces before. But now that I'm older, I want to expand my jaw. Is there a way to do that with a dentist?
You can do limited expansion with probably Invisalign.
Really?
But
Invisalign will?
actually, yes, a lot of adult women, they are embarrassed to get Invisalign.
Yeah.
I think it's great. I mean, I'm
Yeah.
not sure about your case in particular, but in general, it's great that adult women, they decide to get Invisalign.
It's better than braces, though, I would say, because you don't have to.
It's usually just easier because it's more cosmetic, and it's
Right.
easier to maintain it clean. So adults usually like Invisalign more. But it's great if you decide to do that as an adult. To freshen up, get Invisalign, whiten your teeth, do
Oh, it
what you
whitens your
can.
teeth too?
It's not harmful. People think that whitening is harmful. It's not really harmful. If your teeth get sensitive, you take a break and you can choose lower intensity device. Whitening is usually not harmful. I wouldn't recommend using those toothpaste very abrasive and brushing really, really hard. That's not good. You want to be gentle.
Right.
But even those over-the-counter strips, they work and it's not harmful.
It's not harmful. Wow, yeah, many people think it's harmful.
Yeah.
Okay, that's good to know. But my curiosity is with Invisalign, because I know that Invisalign just shifts the teeth, kind of like braces.
Yeah,
I
so
didn't know
that's
they
what
whiten teeth too.
Invisalign's not gonna whiten your teeth.
Okay.
You're gonna need like strips or something. So Invisalign's
Oh,
gonna,
okay.
yeah, gonna only move your teeth.
So I
So
misunderstood. Okay. So they
No, we're
always
just saying like do like what makes you happy. Do Invisalign. Do whiten your teeth. Do what makes you happy.
and whitening is also youthful,
Yes.
right? So that's
Yes.
something that we, us women, especially moms, we want to stay
Oh
youthful.
yes.
So what are some simple daily habits that make the biggest difference?
Well, creating those routines that are pleasant.
Right.
You know, you have to somehow make routines pleasant, even flossing, make it your me time after the kids are sleeping. Those are simple things that you're gonna stick with them.
Okay. And is there something moms can put in their purse that they could quickly do while they're out with the kids for their teeth?
Yes, absolutely. I do think they even have little those portable wipes. If you want your teeth to be more white after drinking coffee, you can wipe them.
Wow. Is this over the counter?
I believe so.
Wow. So just quickly, just with a wipe.
Mm-hmm. Mm-hmm.
Interesting. Does it remove plaque?
It removes a little bit that plaque. Mm-hmm.
That's what we want. We want to get rid of that
That
plaque.
maintenance, yes.
Yeah.
You can have a little bit mouth rinse in your purse also. After drinking coffee, you can freshen up.
Yeah. So question, bad breath. You
Mm-hmm.
guys deal with that as well, I'm sure.
Mm-hmm. Yes.
Where does that stem from and how can people get rid of that? In the morning
Yeah.
especially, because you're saying the morning is not as important, but for me it's
Yeah, for
like,
the bad breath, yes.
yeah,
A
yeah.
quick brush,
Yeah.
like just few seconds at least to
So
freshen
does
up.
it
Yes.
stem from plaque?
Bad breath can, yes, it can be from plaque. It could be after night. It's normal. We had, been sleeping. Dry mouth. Dry mouth
Mm,
causes bad breath. Actually, our mouth likes to be moist.
okay.
Sipping water helps a lot. Saliva is actually a good thing. It neutralizes your mouth. So dry mouth also causes bad breath.
Dry mouth.
Sometimes it could be underlying conditions from the health from the stomach if it's really intense. So you
Wow.
can check with another doctor.
Okay, that's interesting. So it's good to keep an eye on it
Yeah,
just to
what
see.
causes it? It could be
Yeah.
different reasons.
Okay. Wow, I didn't know it could be from your gut. Just
It could be um as pregnancy causes reflux.
oh, yeah,
That
yeah.
that also can contribute.
Yeah, it also ruins your teeth because I remember,
Oh yeah.
my mom, I didn't throw up, but I had a lot of nausea, but after throwing up so much, like, your teeth get, like,
It's acidic.
acidic,
Yeah, acidic.
yeah. So is there something to do to reverse that, or does it automatically go back? I mean, we can't help it when we're
If it's
pregnant.
really, yes, if it's really significant damage, you can't really reverse it, but you can help after throwing up. Again, rinse with water to kind of neutralize that acidic
Yeah. Is
dryness.
lemon bad?
Lemon, yes, you don't want to soak your teeth in lemon.
Right, because I love
If
water with lemon,
yes,
but
if
it's
you
not.
can, if you can drink it with a straw, that's gonna minimize exposure to the teeth. So if you're
Ah,
gonna sip it with a straw,
that's good to know. So
yeah,
straws for the
straw.
teeth, but for, smile lines, not good. There's pick and choose, right? So how can moms model positive dental care behaviors at home?
Well, you can brush teeth together, you
Oh,
can
that's a
have
good one.
healthy snacks. It Kids do what they see. So if you're
Right.
gonna have good habits, your kid's gonna do exactly the same.
Right, right. I know my son, when he sees me brush my teeth, he's like, "I wanna brush my
Oh
teeth."
yeah.
They want to copy you. They
Oh
want
yeah.
to, like, you're their parents, so they wanna, like, be like you. So what myths about dentistry would you love to debunk?
Well, I wanted to say a couple things.
Let's hear it. I'm really excited.
I mentioned already that brushing hard is not really good. So that's myth. Sometimes people think if I'm gonna brush
They get
hard,
all the
yes, if I'm gonna press, that's not good. Um,
I need to talk to my husband about that because if you see his toothbrush after, like, a month, it's, like, all over the place. I'm like,
yeah.
"What are you doing?" I'm like, "That." I'm gonna tell him this.
Yeah, and they do have toothbrushes that if you press too hard, it gets like a red light.
Wow, maybe
So
I need
that
to
would be
get that
helpful.
for his next gift.
hmm Also, that we mentioned that whitening is harmful. It's not really. Usually, it's not harmful. You can whiten your
It
teeth.
just gets sensitive, but that's
Yeah,
not.
and then you can take a break, or
And
you
start
can,
again. Wow.
and you can choose something weaker. If it gets too sensitive, that's okay.
Okay.
That's reversible.
Okay, that's good to know.
Another myth that it's very controversial about the fluoride. We dentists actually we do like fluoride, and fluoride
Really?
somehow under 2 years old, if they swallow the toothpaste, skip
Right.
it, of course,
Right, right,
So
right.
you don't want to eat fluoride.
No, no, definitely
But the
not.
toothpaste, we like it actually. It's
For the
proven that it prevents cavities. So fluoride is not exactly evil.
Wow, that's interesting because
But
I know everyone's trying to stay away from fluoride,
I
especially with the
don't,
kids. Because the
yeah,
kids
if they're gonna swallow, yes,
right, right.
but it's not really that
If you spit it
harmful.
out.
And it's actually really proven that it helps cavities.
Wow.
We do.
So, do your kids use a fluoride toothpaste? They
Yes.
do.
Yes.
But obviously you make sure they don't swallow it.
Yes.
Okay. And how do you do it? Because I know there's different types of, um, routines, right? There's some that drink and spit out, like, do you use mouthwash for children? Like, do you
I
recommend?
don't. I don't.
No? Not
I just very
the
simple.
Listerine, but, like, there's one for
For
kids
the
I saw.
kids, like I said, it's optional.
It's not okay.
What matters is brushing. And the thing is that we need such a tiny amount of toothpaste, really. It's the size of like a pea, or for the kids, even like a,
I put the whole
no, 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 we need just a tiny bit. That's the thing that also people use too much toothpaste. We need
because we
just,
think it's gonna clean you.
no, no, we don't
So
need
that's a
much.
myth.
Yeah, we need just a tiny bit.
Okay, we'll save some toothpaste.
Yes, yeah.
Any other, myths to debunk?
What else? Well, another thing that's very popular, oil pulling.
I've heard of that.
I
No,
don't know. It's not really proven to be very
no,
effective.
it's become a
People,
trend.
yeah, people try to find something magical. It's actually very simple. Just brush your teeth, floss. You don't need to spend half an hour with the oil in your mouth,
Yeah.
It's
It's
okay.
probably not a good feeling too to have
I don't know. I haven't even tried it actually myself.
yeah,
Just to me, mm,
yeah, everyone is trying to
simple.
find shortcuts, you know?
Shortcuts or some hidden secrets,
Right,
or some people think that it can reverse the cavity. No, once the cavity is there, it's there.
that's it.
You need a filling. Yeah,
And if you don't take care of that feeling
it's gonna go big and bigger slowly, but it
into a
will
root
get
canal,
bigger.
that's what happens if you don't
Eventually,
oh my
eventually, but that
gosh.
takes years. So if you have a cavity, it grows slowly, 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 and it could go all the way to the root canal.
Wow. I mean, I remember when I went to the dentist, they're like, "You have a little bit of cavities, like, in the front." I'm like, "How did I get it in the front? I didn't know you can get cavities in the front because usually the holes are in the back, you know?" But
Yeah.
so I'm waiting to see, what
Yes,
happens.
if it's just starting at, you can reverse that.
Oh, you can?
Even like the tiny, tiny bit dot on the very surface, that you can reverse.
Oh,
But once it gets deeper than enamel, because we have layers, then you cannot reverse anymore. No oil
interesting.
will help it. No,
Yeah.
then you need a filling.
Cavities are not fun.
No,
Y
but you can prevent them.
yeah. See? That's the trick. I like that. So what advances in dentistry make visits meaningfully easier today? Like, what can you do that make dentistry visits more meaningful?
A lot of changed in dentistry within even like 10 years ago. The equipment
Really?
got more quiet, more
Mhm.
gentle.
Yeah.
It's still one of those places that you don't really look forward to go to.
Not
So
really.
yes, you have just to choose the place that you like.
Mhm.
And social media, actually, I think it's helping a lot
Yes.
because now dentists trying to be funny, making videos. So you
Yeah.
see the dentist with just goofy people like everyone else,
Yeah.
not that
Yeah.
scary person with a white coat that you don't know what he's gonna do.
Right.
No, we're the same goofy people. So I think
Yeah.
social media also helps a lot.
Yeah, definitely. So social
Mhm.
media could be good.
Oh, yes, absolutely.
Yeah.
There are, good sides of social media,
Right.
absolutely.
And I think it's important to build a relationship with your dentist
Yeah.
because it makes you, when you have a relationship and you feel good, you feel more comfortable.
And you know the office. So it's not something scary and unknown. You know the
Yeah.
office, you know the people.
Right.
Yeah.
Right. People were saying that robots are going to be taking over a majority of jobs, but I don't think they can take over dentistry jobs
Not
because,
that soon. We don't know
yeah,
what's gonna happen, but it's not gonna happen too soon.
yeah, no, we need the
And that
dentist.
human touch.
Yes, it's
Hmm
100% very, very important. So if you could give one message to moms about prioritizing their own health, including dental, of course, what would that be?
Let's just remember ourselves. Let's love ourselves. We do forget us as moms. We are
Yes.
so busy. Work, family, kids, food, everything. And then we really even forget to eat lunch ourselves. Like I said, we cook for our kids, we buy healthy foods. What do we eat? Leftover. Half a
Yeah.
chicken nugget, that's
Exactly.
okay. Yeah.
Go to bed over one
Yeah,
chicken
yeah.
nugget. Yeah.
Let's just remember ourselves. It doesn't take much, even 15 minutes, but every day, even 15 minutes, something for yourself. No phone, no husband, no kids. 15 minutes every day. It could be your nighttime routine, it
Yeah.
could be a walk. It's gonna really be very, very meaningful.
I love that. Are most of your clients patients, I'm sorry, mothers? Or is it a
Probably it's
variety?
a variety. It's actually a variety. Usually moms make appointments for husbands too,
Yes.
usually,
Yeah.
but not necessarily.
Yeah. So you've been
Yeah.
doing this for 2 years, you said?
Dentistry in general,
Yes.
in this country, over 10
Oh,
years.
over 10 years.
Mhm.
Wow.
Yeah.
I need to come. I need to come to you.
Yes.
Yeah. I'm not gonna be scared. I'm
No, no, there's nothing to be scared. Yeah.
Yeah, yeah.
You just come, you get a checkup, and then it's up to you to decide.
Yes, I love that. Well, thank you for being here today. And for everyone listening who's afraid of the dentist, please to take this with you and know that they're
Oh,
just people,
with the same goofy people.
same goofy people. And I will link all her information if you're in the South Florida area and want to go to an amazing dentist. I will link her information in the description. Thank you for listening.